If we're all settled in, we're going to begin with our second session. I'd please like to call on the moderator and speakers of the second session to come up on stage, please.
Welcome everybody to the first session. So the first session will be tackling the fatigue in host communities and among refugee communities. Again, as the whole methodology of AUB4Refugees and as described by Dr. Nasser and by other AUB colleagues, it's a multidisciplinary approach. So with us on the panel, we have a myriad of expertise coming from different sectors and from different faculties here at AUB. So basically, we're going to start with Ms. Yara Mrad, that will be giving a bit more of a general perspective of the situation and how host communities and refugees are tackling fatigue. She'll be speaking most importantly about the impact of the humanitarian situation as a whole in respect to the fatigue that is present.
I'm very happy to be speaking here today. I won't be presenting, as George said, on a specific project, but more so I'll be drawing maybe the bigger picture on fatigue, so as to set the scene for the remaining presentations to come. Most of the data I'll be presenting today has been collected during our research work at the Institute, while we try to attempt to contextualize the current crisis, and to bring scientific evidence to the current debate. I'll just give Muhammad a second. Okay, so again, happy to be here. So today I'll be talking about the fatigue and giving some numbers related to it. I just want to start with a little bit about the program. So the Refugee Research and Policy Program at IFI seeks to serve as a platform for refugee-related policy-oriented research that achieves three goals: enhance the Arab world's research input, enrich the quality of interaction, and raise the quality of refugee-related debate and decision-making. And I can proudly say that the efforts are being exerted by 8 super harding team members at the Institute. Okay, we are here today towards the 8th year of what has become the worst humanitarian crisis since World War II. The war in Syria has had catastrophic impact on millions of individuals, as mentioned earlier in the opening session, leaving over 6.2 million internally displaced and another 5.6 million seeking refuge in neighboring countries, which together would constitute around half the population of Syria. Lebanon alone has hosted over 1 million refugees from Syria since 2011, and currently around 950,000 registered with the UNHCR. Even though this number has recently been decreasing with some sporadic waves of return, the numbers of return are really overshadowed by the number of people who remain here at high humanitarian risk. Levels of fatigue that refugees and host communities have reached reflect serious concerns, as both struggle to cope with the impacts and burden of this displacement. At the Institute, the refugee program did a short research exercise or activity on this topic, and we produced this infographic which we disseminated widely to the public, trying to spread this evidence for proper decision making. And more recent data will be presented during this presentation, and I'm going to be talking about 3 levels of fatigue. So first, refugee fatigue, then host community fatigue, and finally donor fatigue. If we look at the trend over time in terms of poverty among Syrian refugees in Lebanon, we obviously see that it was on the rise since 2014 up to 2017. If we look at some numbers from 2018 reports, 68% of the displaced Syrian households live below poverty line, which is $3.84 per day, while you have 51% living below the survival minimum expenditure basket, so more severe poverty line. Now, and the unemployment rate among this labor force is at 40%. Now, we may say that the poverty, the percentage below poverty line may have dropped slightly from last year, but if you also look, you still have a considerable number of Syrian refugees in debt. So you have 88% of Syrian refugees have debt with an increased amount of debt per capita. So it's at $250 now versus last year it was at $227. And with 43 of them having a debt that is greater than $600. 91.5% of displaced Syrians and 94.5% of Palestinian refugees coming from Syria. So we always try not to forget that there is also a considerable population of Palestinian refugees that are coming from Syria, are food insecure. You can compare it, it's a comparable number to 2017. More on the refugee fatigue level, 54% of school-aged children, 3 to 18 years of age, are out of school. 54% of the refugee household reported that they require primary health care. 55% of Syrian refugee households in Lebanon in 2018 live in shelters that are substandard. So as Ms. Mireji Wright had mentioned in the opening session, we're finding them resorting to more and more substandard ways of living. Only 27% of individuals registered with UNHCR have a legal residency this year, and this number has been steady from 2017. If we want to move on to the host community, the host environment has its woes of its own. And if we see that we have 87% of registered Syrian refugees and 67% of the poorest Lebanese living together in the 251 most vulnerable areas of Lebanon. You've probably seen this map more than once, but it's good to just remind ourselves of really the situation that they're living in. 27% of Lebanese live below poverty line, and this has just exacerbated the already poor situation that's there. Lebanese host communities, unfortunately, have reached a point where they've had negative perceptions regarding the extended presence of refugees. Maybe in the beginning of the crisis, when some refugees were coming to the Lebanese side, it was not really considered as a threat to them or as a burden, because a lot of Syrians were bringing their families. Many of those Syrian refugees knew Lebanese families here already. But with the passage of time, you see that the situation is a little bit going downwards. According to certain reports or surveys, 92.9% agreed that the presence of Syrian refugees is placing too much strain on the Lebanon's economy, like water and resources. 41.6% living in vulnerable cadasters reported knowing someone who has lost their job or their occupation to a Syrian. 63.6% of Lebanese that were surveyed stated competition for lower skilled jobs as their primary cause of tension with refugees. Even if these numbers are just perceptions and what people think, they're very serious, and they are affecting the social relations that are only getting worse and worse. In another study, more than 1/3 of Syrian refugees surveyed were found to be experiencing verbal harassment in the last 3 months prior to the survey. The percentage of respondents who experienced verbal harassment reached 27.8% as compared to 20.3% in 2017. Although we do have reports of Lebanese who report harassment, verbal harassment as well, and it has probably been increasing over time, it's still significantly much less than the percentage reported by Syrians. Furthermore, fatigue within the Lebanese host communities has really manifested itself through the call for return that has hastened dramatically during the last few months in 2018. It has now become like a nationwide policy, even though highly controversial among several political parties, with the Office of General Security coordinating with the Syrian government for the return of hundreds of refugees. Finally, to move on to the third level of fatigue, donor fatigue, which has been really playing a critical role in the last period, given that the crisis has been into its 8th year. Donor fatigue, or donors actually have a crucial role in the humanitarian process, as their contributions are what make aid provision actually possible. So if you want to look at what was appealed and what was actually received, we still have a gap. The gap in funding that from the appeals limits the humanitarian assistant outreach significantly, which means that this leaves organizations unable really to provide the necessary resources to those that need. We see that there's a gap of almost 66%. And if we were to look more into the different sectors, you see a widening gap from last year across the different sectors. So the dark color is what was appealed, and then you have the blue in the middle, which was actually received across these sectors. Without additional funding in 2018, some sector partners might find themselves prioritizing maybe food assistance to really just a small selection of people who they may deem previously vulnerable, and having to leave another bigger population without this assistance. This means that people will no longer be assisted and will more likely have to go to these negative coping mechanisms that we see and which I will discuss shortly. So obviously we have two types of mechanisms, coping mechanisms, positive if you want to say in some sense as positive, and the more negative ones. In recent reports, certain coping mechanisms have been reported, and they include sharing information about food, so they help each other access food, learning new skills to try to adapt and try to move forward, community solidarity, supporting each other, such as taking each other's children, taking care of each other's children while the other one is working, and support from relatives abroad. The more worrisome actually than the actual positive coping mechanisms would be the negative ones, and that 3 out of 4 actually resort to certain negative coping mechanisms. A few of the negative coping mechanisms that were mentioned include that they no longer seek the service. So if they need healthcare, education, food access, they no longer try to access these things. You have street and working children. You have child marriage and survivor sex. You have involuntary return, so they return just because they have no other choice, but it's not what they would have wanted to do. Restricted movements and no interaction with the local community. And this is where we have this increasing problem related to social relationships and inter-community relations. In line with this, the institute, the program at Issam Faris Institute has been undergoing various research studies that explore certain coping mechanisms. I won't be reporting on the findings. I'll just brief you on what we're currently doing in 3 of our projects. So one of our projects is looking into the informal adaptive mechanisms and trying to understand adaptation, resilience, and agency in securing livelihoods in the informal economy among refugees from Syria in Lebanon and Jordan, so as a comparative study. We try to understand the various adaptive mechanisms adopted by the Syrian refugees in securing their livelihoods in the informal sector, and to try to initiate a national policy discussion on how to understand them. We're going to go about it through case studies, looking at different case studies in Lebanon and Jordan, and trying to make some conclusions from that. Another study is related to the housing market. So it's looking at the impact of occupancy free of charge. It may not be a coping mechanism per se, but it is sometimes the only option for certain refugee families to access shelter. So here we're going to look at the assessment of occupancy free of charge modality to refugee shelter applied in Lebanon, look at the impact on the Syrian refugees' well-being, and try to tackle the impact of this insistence in improving the refugees and host communities' social cohesion. And of course, there will be the angle looking at what effect has that had on the Lebanese housing market, because at the same time you are making more shelters available, at some point the refugees hopefully will be able to return safely back home. What will happen to the Lebanese housing market? Lastly, we have the poverty alleviation and women refugees in the Middle East, empowerment through grassroots micro-entrepreneurship. So here we're really trying to get a deeper and richer understanding of experiences of certain refugees, Arab refugee women, who have received some assistance to start a small business, and to see how this has helped them. And they were followed up over a year. So we contacted them at some point and followed up with them in another year. And hopefully we'll have these results out soon to share with you. So this just brings me to my sort of concluding slide. How have we not yet collapsed? This is a question we always ask. Nasser always asks it in his tweets. We've survived that long, 8 years, but how much longer can we go? So through the adaptive mechanisms and coping strategies, including sometimes resorting to informal methods of access to services such as healthcare, education, food access, we've a sort of resilient, if you want to say, Lebanese society and resilient refugee population has sort of prevailed. However, given this rising level of fatigue that we just discussed, and I'm sure we're going to discuss it more in the next presentations, and given the worsening inter-community social relations that we see, we can only wonder how much longer will this resilience last, and how much longer can we survive like this. I'm sure many of the presentations today will tackle different aspects and maybe, if not provide answers, have a bit of reflections on this question. Thank you.
Thank you, Yara. Exactly like I think Yara has presented a large context that we're going to delve more into it more specifically. We have speakers that will be speaking about child labor and socioeconomic issues. We're going to speak about maternal health. We're going to speak about socioeconomic issues in the lens of microfinance and about water management and infrastructure in general. We'll move now to our second speaker, Dr. Youssef Fawaz. Dr. Youssef is a senior lecturer here at AUB at the Department of Civil and Environmental Engineering. Also, Dr. Fawaz is the executive director of Al-Majmu'a. He will be speaking more about the work of Al-Majmu'a in microfinance and how they have successfully taken high risks by supporting refugees and by supporting their resilience in Lebanon.
Thank you. First, I want to begin with a brief apology to the panel and the members of the audience. I have a prior commitment and I may have to leave the panel slightly before it's over. So I apologize for the rudeness of the behavior. I'm here today to speak about the experience of Al-Majmu'a. Al-Majmu'a is essentially a microfinance institution, an NGO. We're the largest in the country. For those a bit unfamiliar still with the concept, microfinance essentially targets segments of what we call the working poor, people who have small businesses but are unable to access commercial financial services through the normal banks, either because the loans they're interested in are too small or because the collaterals, they do not possess the collaterals and guarantees that a typical bank would ask for to be able to extend them a loan. So we're interested and focused in our social mission in promoting youth and women in particular, and try to include them as much as we can into what we call the formal financial services. We provide, in addition to microloans, we also provide a number of non-financial services in the form of financial education, entrepreneurship, how to build and start your own business, how to manage properly and do proper accounting and whatnot. Essentially, the tools to help small entrepreneurs set up and increase the size of their business. So very briefly, today we're about a 450 employee NGO. We have 30 offices across the country. We have about 83,000 active clients, meaning people who have loans from Al-Majmu'a, with a total outstanding portfolio of around $86 million US. The focus of our work is, as I said, essentially women, and today we have 57% women in the portfolio for only 43% men. And from the onset, Al-Majmu'a has been engaged with refugee in this population by being present in all the Palestinian refugee camps, and we have worked with Palestinian refugees. Later on, we worked with Iraqi refugees when they came in maybe 10, 15 years ago, and we worked with any migrant community legally present within the country. Obviously, when the Syrians came in, that was one of the first issues we thought about as the waves of Syrians started coming into the country as refugees. We faced with the question whether Al-Majmu'a ethically and socially should be engaging with this community. We conducted fairly quick surveys, some focus groups within Syrian and Lebanese host communities about the potential needs for the refugees. And the ones that we had come up with is that may need loans, remittances, and obviously savings, something us as an NGO cannot possibly offer. And in terms of non-financial needs, we found that they were interested in receiving financial literacy, basic bookkeeping, basic accounting, and entrepreneurship trainings. And in a few cases as well, we found it was useful to provide vocational training in helping some people acquire skills so they can start an income-generating activity. So we felt committed as Al-Majmu'a, as a financial institution with a strong social mission to provide both types, the non-financial and the financial services, to both Syrian and host communities. Dealing with refugee population for microcredit is always a bit of a risky business. Already we're perceived as risky because we deal with a poorer segment of the population, people that are typically perceived as unable to repay back their loans, people who are erratic in the way they deal with money because they have no experience to it. And added with refugee, a number of constraints or challenges or barriers, if you like reputational risk. There is always lots of apprehension on the part of the host community, the perception that they're coming in and stealing our jobs and taking our businesses and undercutting us in terms of competition and whatnot. Add to it all the societal fears and prejudice that you will find. Plenty of legal impediment. It is quite difficult for Syrian refugees to get residency permit, let alone get working permit. The number of activities they can engage in are fairly limited. The government on this, unfortunately, seems to have adopted a rather tough line and is inflexible as far as we could tell. And add to it general lack of information and misunderstanding and the perception, obviously, that refugees, being mobile, being refugees, could be even more unreliable as a market segment because they could take the money and they could represent what we call a flight risk, in the sense they could take the money one day from you as a loan and then just disappear or go back to Syria or go back to a third destination. Nevertheless, we decided as an institution to take the step of doing a small pilot program and trying to develop some relationship with the Syrian refugee community. And we started by targeting essentially women at the beginning and a two-pronged approach. The point, again, to be very clear, is not for us simply to give loans. We're not out there to get people in debt for the pleasure of getting them in debt. We really try to be extra careful that we don't get anyone in a high level of over-indebtedness. We make sure that we understand their financial situation before deciding to grant a debt. We've even done a market study and segmented the Syrian refugees among three major groups. The first one being people who are able and capable of taking on a debt and repaying it because they do have an income-generating activity or have some means of support that would justify their ability to take a loan. The second group, which is in between, who need some additional help and assistance in terms of non-financial services to be able to take a loan. And the third, and which are, by the way, the vast majority actually, are unable to carry a loan because they're really at subsistence level and they need sort of food and lodging help. The programs we started was at the beginning non-financial in that we started giving financial education program and vocational training to both host community women and Syrian women. And one good outcome of this is it's helped actually improve the social cohesion between the two communities. Having women from both groups sitting together in classes for month after month, maybe 5, 6 weeks, 8 weeks at a time, helped break down the barrier. And what we saw at the end, sometimes Lebanese women who had lots of apprehension at the beginning were willing to accept a Syrian woman within their group so that she can take a loan with them and they co-guarantee her. By the way, one of the basic models in the way Majmu'a gives loan is what we call a group loan, a Majmu'a loan, in which we give, instead of giving a single woman a loan, we give to a group of women, usually 5 or above. And all we ask in terms of collateral is that they co-guarantee each other. So it's based on group solidarity. We have a commitment that if of the 5 women, one of them doesn't pay, the 4 others will pay her share. So we substitute the need for a guarantee with a group collateral. And this group, and hence the name of our institution, Al-Majmu'a, this group of Lebanese women started accepting Syrian women within their midst. So it's having 4 or 5 Lebanese women and 1 or 2 Syrian women within the group, co-guaranteeing each other for the period of a loan, which typically goes from 6 to 8 months. With time, as years went by and we built a bit more experience and knowledge about dealing with the Syrian community, we started feeling more comfortable giving loans to a group of Syrian women alone without even having a Lebanese woman in the midst. The repayment rates have been reasonably excellent, even after 5 years. The portfolio at risk, meaning the one that are the unpaid part of the loans, is on par, similar to what we observe with the Lebanese community. And we've observed very few cases of a flight risk. We've done something that is similar to an impact study, but not extremely fairly quick. I mean, we took a sample of 103 Syrian refugees who were our clients in 2017, and we interviewed them 2 times. One obviously when they took on the loan back in August, September 2017, and we did a second set of interviews roughly a year later in July 2018. Again, not a full scientific impact study, but more of an assessment of interaction of credit access and livelihoods. We noticed what we could understand from the way the Syrian refugees have used the credit that was extended by Al-Majmu'ah was for 23% to invest in their own businesses. We're talking here about women working from home, being a seamstress, being a hairdresser, being someone who does food catering, some sort of income generating activity, and they use the money to invest in the business. The average loan size being $775. 13% used it as working capital. On the second loan, by the way, we noticed that the number of percentage of people using the loan for business activities increased, indicating that in the first time they took the loan, they may have used it for a bunch of other reasons, typically related in the second other 2 points, either to help get a reasonable apartment, debt repayment. Many refugees get in debt, usually at very high usury rate, to be able to complete their journey to the country, sometimes for food, emergencies, household health, etc. As a perception, again, talking to the 103 we spoke to, 96% felt better having been able to access a loan, having had an institution willing to give them access to a financial service. True, not everyone has an easy time. 17% of family had difficulties to repay, but the highest positive income was perceived in access to health services, family income, access to food, improvement in housing conditions, and access to consumption food. So, I'm done. Last slide, and you'll be free. So, main results, the Syrian refugees appear to be able to manage the credit. So, despite the perception that simply because of their refugee status, they're more risky a segment to deal with financially, does not hold true after our pilot program. Furthermore, from the small sample of 100, the credit does not seem to harm them, instead contribute to support the livelihood improvement. And that we noticed that the credit has been able to contribute to foster the financial inclusion of typically excluded population. They help them invest in productive opportunities. They help them cope with emergencies and health needs. And they can support in the increase of economic resiliency in terms of indebtedness, cash savings, and revenue. Thank you very much for your attention.
Thank you, Dr. Fawaz. We move now to our third speaker, Dr. Delcock. Dr. Delcock is a senior lecturer at Department of Health Promotion and Community Health here at AUB. He will be speaking more about the risk affecting maternal health care in Lebanon, in particular in lens of the shrinking of funding, but also in matter of Syrian women also avoiding regular healthcare facilities. I think if you want to go back to the opening remarks of Dr. Mitre, he mentioned how much this issue is sensitive when it comes to the public image.
Over coffee.
Please go ahead.
Thank you very much. And thank you for inviting me. I'm glad to be here. I want to share with you probably 1 or 2 questions. What's going to happen to maternal health and maternal health indicators in the face of donor fatigue and community fatigue, and why this is important? Okay, so we're going to give you a little bit of background and then look at why this is important. Anytime you want to discuss maternal health, you have to look at determinants like the population they're in, indicators relevant to maternal health, quality of care, vulnerabilities, and funding. As reported by Nasser lately, that 81% of the registered Syrian refugees in Lebanon are women and children. And this is a lot to worry about. These women, they have different characteristics than the host community women. The total fertility rate, that's one of the main determinants of maternal health, have went down 50% from the pre-Syrian crisis to post-Syrian crisis. It went down from, it's now like close to 3.1 or something. It was around 2. The prevalence rate, which was 61 before the Syrian crisis, meaning that 61 of women are covered by one way or another of family planning method. This went down by around 20%, and the crude birth rate went up to around 28 to 33 per thousand. These indicators are reflective of unmet needs in terms of family planning, unmet needs in terms of trying to plan birth or space birth. And that reflects on definitely the quality of the maternal indicators. The other thing which is also worrying is the trajectory of childbirth from, let's say, 2011, the beginning of the Syrian crisis, all the way to 2017, and you're talking about 19,000 deliveries at that time to around 55,000 projected in 2018 of non-Lebanese. Never in the history of any country, since the pharaohs probably, you have like almost 45% of deliveries in a certain community are not residents or nationals of that community. Okay? That's by itself is a lot. This is a recent paper showing how the population, especially of women and families, are reacting in terms of what's happening. This is, probably I forgot to put the transition of the slides. But anyway, this tells you 3 things. The first thing that I'm going to tell you is that more and more women are coming late to book in the pregnancy. Instead of coming early to booking, they come like 4th or 5th or 6th month, which means at least one important thing you're missing on a preconception care and folic acid intake, which is a main evidence-based protection of newborn anomalies and fetal problems and stuff. So this is at least one thing. And the other thing, you're missing to identify any kind of medical problem that's going to worsen the pregnancy and the pregnancy outcome, and you're going to see the impact of this later. The other thing is also less and less going in number. So they're going late, but also less and less are going in the first place because it's too expensive, transportation problem, poor quality. I can show you why it's a poor quality. Dislike waiting time, in addition to all the structural violence they suffer from within that setting, and the dignity issues and the humiliation they receive. This is one of the, for me as a gynecologist obstetrician, this is very poor. This is bad. Even if you do 15 visits during pregnancy with such a content, it's nothing, okay? You don't satisfy the basic things, like this is the basic stuff you should receive as a pregnant woman. Only 31% are receiving this. Supplementation in a community of the Syrian refugees where anemia is prevalent like 20% and iron deficiency is around 42%, only up to 56% are receiving iron. So this is like, they can do without this pregnancy care in the first place, okay? If you send them iron to the settlement. So the quality of care has an issue of not only equity, also of content. The third problem also with the fatigue in relation to antenatal care is the payment. Look at the payment. This is like, for a cesarean section, the median is 494 and the mean is 374. And for a normal delivery, this is a lot of money for Yara, 70% are poor or something, you said. This is a lot of money. So they say, why should we go? We shouldn't go. With the 4th and 5th and 6th pregnancy, we shouldn't go. Allah bidabbir. Why should we go? Okay? So this is serious. And this paper doesn't capture everything. As a clinician, I can tell you there is a lot of indirect also money they pay for unnecessary testing. We know the hospitals, we know the insurance companies doing this, and you know everything, but this cannot be captured also here. So if a pregnancy will cost her close to 1 million, 1 million. Even the Lebanese pregnant women, they go for the ministry to deliver the ministry and they pay 10%, which is like 100,000. You expect a Syrian refugee to pay 1 million? That's also very serious, especially in becoming like us. They came from Syria with 22%, 21% cesarean section rate. Now it's close to 40%, like the Lebanese. شبهوا فينا بالcesarean. 40%. More money, more unnecessary surgeries, and future risk of the future pregnancy, because the more cesarean you do, the more problems you're gonna face. This is going with some of the global papers showing also that global studies, that maternal mortality rate, total fertility rate will be higher in places who had conflict over the past 5 years. In another paper also from Turkey showing that there might be a trend for poorer outcomes among the refugees as compared to the local. Same thing for this recent paper also from Jordan showing, again, increased risk of indicators like cesarean, anemia, and other problem with the newborn. In Lebanon, some of the few papers have shown they deliver too early, like prematurity is probably more than 20%. It should be close to 8 to 9% in a normal situation. There are more admission to the intensive care nurseries, more hemorrhage or bleeding after delivery, which are all serious problem. Same also in 2 recent papers from Turkey showing poorer outcome or a tendency for poorer outcome in this. So in Lebanon, what we are trying to say is, one is, do maternal death, unfortunately, or maternal mortality, morbidity behave differently among the communities and the Syrian refugees? Why and why not? This is the selected indicators from the Ministry of the Maternal Mortality, and you can see this is, look at the maternal mortality rate for Lebanese and for the non-Lebanese. You can say in the last 2 years they're getting more. Just look at this is the trend for the Lebanese. We're leveling. There is no significance here because already the numbers are not really much, but the trend for the Lebanese is going a little bit down. For the Syrians, from 12.8% to 27%, it's almost doubling. Like in 2014, 2013, the Syrian death was like 4 cases per year or 3 cases. These are the registered ones. While 2016, 13, 2017, 14 cases. And that's a serious trend when you talk about maternal mortality. It's a very serious, dramatic, sad issue, but the numbers are not really small. What's bothering or what's really sad is that these are young women, 17, 18, 16, 8, 19, dying while giving birth, giving life. That's, and they are part of 275,000 women globally. Some numbers go up to 300,000 globally of young women dying. So there is a serious trend, and we believe this is gonna get worse also with the fatigue and the shrinking of money and stuff. And the other important thing, as you are also noticing, is that the type of maternal death among the Syrian refugees is changing. Now they're dying because of indirect maternal causes. What does that mean? See, when you go early to pregnancy, the physician is able to detect early any problems that are going to worsen your pregnancy. But if you come late to pregnancy, like during the 4th or 5th or 6th month, then these problems are already affecting the pregnancy outcome and the mother's outcome. So if more death is happening of indirect reasons, which means this is going to increase more next year and the year after, because less and less pregnant women will be going, but the pregnancy will probably be increasing. Because those who came in 2011, a father and a mother and 1 kid, now they have 5 kids. And in 2 years' time, some of those, at least who came to Syria, will be 14, 15 years old. They're going to be married. So you're going to have more numbers, okay, in the face of higher fertility rates, but more risk of dying from direct, but more so of indirect cause of death because they're not going to antenatal care. And also, last year, we have from Medair, which is an NGO working that at least we have an increase of 14 cases of women delivering in tents versus delivering in the hospital. So the debt that the Syrian refugees are suffering from, the shrinking funding is directly affecting pregnancy and childbirth, and that's what we are going to show because for the reasons I have just mentioned. The tendency is that people talk about, last slide, as like recommendation, challenges, and risk and stuff, which I find is very like cliche, okay? There is no solution for this. There is no solution and there is no awareness. This is a community that enjoys high fertility rates. One of the colleagues, they argue that there is an epidemiologic transition that people are realizing more and more that we're staying for longer times, so we better cut down on the fertility rate in view of debt issues and shrinking funding and stuff. That's one idea to observe. Because when you come to, let's say, to Lebanon from the rural areas of Syria, you will be happy, everything is paid for, you're going to make your kids see them on ultrasound, get all the necessary pampering, and then go back. But this is like now, many, many more problems are arising. Will this affect fertility rates? We have to see this. The other thing is, what I think of is, in the face of shrinking funding, and it is shrinking, okay, all you have to do is to make a better pooling of where those pregnant women should go, okay, with a kind of a form that they can go as early as possible, pay as less as they can, and then reassess all the referral centers and cut on some of the corruption that's happening from point A to point F and all the intermediaries. And I think then we can be speaking of curbing or reducing harm that might result on a very important chunk of those women, usually the young pregnant and the adolescent pregnant. And thank you very much.
Thank you, Doctor, for this very informative presentation. I think one added value of an interdisciplinary panel is that sometimes we get information on things we don't usually read on or we don't usually focus on. خلاص. As a fee funding. We move now to our fourth speaker, Dr. Farjalla. Dr. Farjalla is actually one of our hosts here at Isam Fairs Institute. He's the director of the Climate Change and Environment program here at the Isam Fairs Institute. He will be speaking more about another hot topic when we speak about the relationship between host communities and refugee communities when it comes to water management. And he will be speaking more about factors that guide the interaction between the different stakeholders in resource issues.
Sure. Thank you for this opportunity, and I'd like to thank the refugee program, Nasser, Yara, Asil, Waqfa, everybody for helping us out, showcasing where we intersect with our different programs. We work at different time scales, if you will. Climate is working is a little bit slower and larger spatial deal than refugees, which are very quick happening. But when we're looking at refugees, the four primary things that from our perspective are critical is we need to provide shelter, we need to provide food, water, and then clean up after anybody, basically, not only refugees. All these four affect resources and require input, resource input into them. So this is something that is problematic in countries like Lebanon, where we are already suffering from resource deficiencies. And with this, We need to address how the interactions and this quest for better resources comes up and plays in the interaction between host communities and the refugees. Population in Lebanon, just to give a certain perspective, has been increasing steadily since the 50s. And if you look at 2010 divide, there's a sharp increase in population. When we look at that and we assess it compared to water demand, it has been steadily declining. There are three markers that we look at in water availability. You know, when a community is experiencing stress, it's at around 1,700 cubic meters per person per year. And then that is just an inconvenience, if you will. A community experiencing scarcity is at 1,000 cubic meters per person per year. And this is where health issues start cropping up and economic development starts cropping up. And then when you hit scarcity, severe scarcity, that is, the limit is 500 cubic meters per person per year. And this is where development is totally stunted, health issues arise. And I'm not saying anything that we don't ever hear of in this building. We've got health issues with our waters. We've got economic development, stunting, etc. And as you can see, since there's a sharper increase in decline since 2010. There has been a decline all along. It is stabilized before the 70s, in the 70s, and after the 70s to the 90s, and then the economic activity increase led us downwards. And here is where we are at. We are in severe scarcity. And we wanted to look at what does that translate to in terms of relationships between people and communities. And our main objective was to look at a highly impacted region, which was the Beqa. The Beqa is typically a microcosm of Lebanon in that it is a large, expansive area. It has received a huge number of displaced people and refugees. And the number in the Beqa, if you will, of residents in the Beqa doubled practically overnight. The Beqa water establishment was servicing less than 500,000 people in a very, very short period of time. In a year or two, the numbers doubled, and now they are serving practically 1 million. So that is a severe stress on a system that's already experiencing difficulty. So what we wanted to do is look at what the factors are. What are the factors that contribute to conflict over water resources? What of these factors exist in the Beqa, and where do these things exist in the Beqa? And for that, we looked at the primary stakeholders. We didn't talk to the people. The time that we had was very limited. By the way, the project that we undertook for this was funded by the Swiss Development Corporation, and for whom we are very grateful. By the way, the team that did this research was led by Jasmine Al-Qarih. Rana Al-Hajj was working with it. Abdul Halim Hajj Hadi was also working on that. So these people spent a lot of time trying to get this number. And we talked to, in my opinion, the critical people that we talked to were the Union of Municipalities, because they represented the people on the ground as much as possible. We talked to the Ministry of Energy and Water, Ministry of Interior, the Beqa Water Establishment, CDR, Litani River Authority, the Lebanese Agricultural Research Institute, and a whole set of international organizations and NGOs. We looked at the different factors, and we compared what we found in the literature with what we had interviewed. And if you look at it, I'm not going to go for just to keep time, they match. A lot matches. And what people were saying is intrinsically represented here. And these people said that the thing is, population growth is a problem, refugee influx is one of those, agriculture is a problem, infrastructure might be a problem, and the level of society development, which translates in our part of the world to availability of electricity. And then we look at, what data is available. The people we talked to didn't care about data. They wanted the service of water. we look at governance, and that is a key element, and it crops in both areas that we looked at. And then there are physical issues, real physical issues like upstream, downstream relationships, groundwater stress, level of quality of water, how climate is affecting precipitation and temperature, the seasonal variations, etc. And with that, I just want to jump into a series of maps that we had developed, one with the Lebanese population growth rate alone, and then we added the refugees to it. And the numbers, the colors you see are comparative. Don't compare them against each other, compare them within. So if we look at, with Lebanese population growth, the center of stress was in the central Beqa. This is for how much water we can store and use. It stayed the same when we looked at the advent of refugees. But then when you look at the reliance on groundwater, again, the same is reflected in both sides. So we do have a critical problem already existing, and then we added to it more demand and more people. And then we look at wastewater network. Where is that available? Where it is not? And then we looked at it's still reflected in both areas. Then we move more into water supply network. What areas are covered by networks? And here we have a spattering of problems. These consolidated when we had refugees, because less people are being served by the existing networks. This is all that this is saying. Again, if we look at, by the way, we looked at newspaper articles, the 5 leading newspapers, Arabic newspapers in Lebanon, between 2000 and 2016, and we tried to mark any incident or reporting of an incident related to water. And again, the negative parts. It's not like, a digging of a well or something if there's a problem, strikes or demonstrations, etc. And you could see, again, the same is reflected in both with and without refugees. So we try to identify the hotspots, and it's in the northern Beqa, central Beqa, and the Rashaya region. That's when we look at only the Lebanese. When we add the Syrians, Rashaya becomes less of a problem because of the already existing problem. But the central Beqa expanded, and the northern Beqa also expanded. So we have a problem that is there, and it has been accentuated. When we talk to, this is what I want to really focus on. When we talked and interviewed people, we thought that they were going to talk and say, water scarcity is our major problem. It's not there. But they didn't say that. They said water quality is our problem. And then we thought that they're going to say, well, the refugees are the problem. It turns out that the refugees are a problem, but not the people themselves. It's the people that are handling their presence, that are managing their presence. Mr. Lazzarini said that we are being provided, given by the international community, and we're very thankful for that, $1.2 billion. That's great, that's fantastic. But when you spread that over 950,000 people, over 365 days, that's $3.50 per refugee per day. I doubt that's sufficient. So let us keep numbers in context here. So this is something we really need to focus on. So that said, the refugees themselves are not a problem, but there is already a hotbed of problems that at any point might flare up and become an issue. So what can we do? Very direct, simple things that we propose we do. We need to improve communication and ensure transparency, because every time we heard in the morning, this conspiracy theory, maybe it's there, maybe it's not, we don't know. So there needs to be transparency in how the money is spent. What of the $1.2 billion has gone directly to the people? What percentage? What percentage went to salaries? What percentage went to administrative costs? These are issues that we really need to communicate clearly and objectively. We need to, on the physical side, enhance water availability by treating better and making sure that the networks are around. We need to make sure that municipalities are empowered so that there is better decentralization, they can react faster, and they understand what the problems are. And then the most important part is we need to look at a master plan that is based on knowledge and that incorporates population growth and allows for an influx of refugees, or whether disaster-based or human-based. And then we need to keep that in check with climate change effects. Thank you.
Thank you, Doctor, for your presentation. We'll hear now from Dr. Rima Habib. Rima is a professor and the chair of the Department of Environmental Health here at the Faculty of Health Sciences at AUB. Dr. Habib will be presenting the results of a survey they conducted on the working conditions of around 4,500 Syrian children, child workers living in informal tented settlement in the Bekaa Valley. We'll be waiting for the presentation, but I think it's quite an important topic. Like, I can just say, like a big parenthesis, 3 weeks ago we were holding, as Alif, a closed roundtables with 2 municipalities in the Bekaa on child labor. And unfortunately, a lot of duty bearers in the Bekaa or anywhere else in Lebanon still don't recognize the issue as a problem. And we had difficulties even showing them figures and numbers. And sometimes they thought that we're bringing them up from somewhere. So thank you for presenting this, and the time is yours.
Thank you very much, George. It's a pleasure to be here with you and talking about this study. As you know, since 2011, the war in Syria led to mass migration and refugee crisis. And Lebanon hosts a higher concentration of refugees per capita than any other country in the world. You have seen these figures. I'm not presenting something new to you, but I'm just putting my presentation in context. The Bekaa Valley in particular has a large population living in informal tented settlements. So informal tented settlements can vary from 10 tents to about 1,000 tents, maybe, and even more. We refer to them as ITS, or informal tented settlements, and the households consist of tents. The international aid falls short of meeting refugees' basic needs, and this is probably reflecting more on what has been said this morning about the $1.2 billion that are given by humanitarian aid to refugees. So I echo what Nadim has just said. What is the proportion of this international aid that is going to the refugees, and how much is reaching them? 75% of Syrian refugees' households in Lebanon have no access to basic food needs. And these statistics are based on Wazir reports, on UNHCR reports, on United Nations, UN agencies reports that are working here in Lebanon. 58% are living in extreme poverty conditions. And according to UNICEF, 180,000 Syrian refugee children are estimated to be working in Lebanon. A couple of years ago, a group of UN agencies, specifically the International Labour Organization, UNICEF, and FAO, came to us at the Faculty of Health Sciences and asked us to do a rapid assessment of child labor among Syrian refugees working in the agricultural sector in Bekaa. You know that Bekaa hosts, or not hosts, contains or includes 42% of the cultivated land in Lebanon. So the likelihood of people living there to be working in the agricultural sector is high. To respond to this call, we did not do a rapid assessment because at the Faculty of Health Sciences, we don't believe in in rapid assessments or small studies. We like to do things in depth, and we'd like to really examine problems in depth. So we did to answer this request, we carried out a large household survey of working children among Syrian refugees living in informal tented settlements in the Bekaa Valley of Lebanon, and this is to document the impacts of child labor among Syrian refugees working in this sector. We used the UNHCR interagency mapping platform to select a sample of 1,902 households, or tents, should I say, living or being located in informal tented settlements in Baalbek, Hermel, West Beqa, and Zahli. We carried out interviews with female homemakers in each of these households, and also with all the working children living in these 1,902 households or tents. Some of the statistics on this population showed that the average household size was about 6 to 7 members, and these 1,902 households contained 12,708 individuals that were living in these households. 52%, or about 53% of them, were females, and 48% were males. The total number of children residing in the surveyed household was 8,285. 65% of the study population was aged 18 years and under, and the total number of working children aged between 4 to 18, what we call children according to the Lebanese definition of a child, was 4,592. Imagine, out of 8,285 children, we had 4,592 working, starting at the age of 4. And this is one of the largest studies that has, if not the largest globally, that has undertaken individual interviews as I will be, with working children, as I will be discussing later. So we collected data on 4,377 working children in Beqa. Questionnaires were developed for 2 age groups, actually, for this population. Those aged over 8 and 18 years, with whom we carried out face-to-face interview, and they were 4,090 children. And for those who were aged 4 to 8 years, we carried out interviews with an adult guardian in the household, and they were 287 kids. We did not want to interview 4 years old or 7 years old, obviously, for obvious reasons. 48% of the working children were females, and 58% were male. 34% of the working children were between 8 and 12 years, and more boys start working at an early age, as this graph shows. As for the key findings on working children that resulted from the survey, and that's the age group is between 4 and 18, children started working when they were 11 years old on average, 10.9 years, which was true for both males and females. This is an early start for the hazardous work that is involved in agriculture. So as compared to other studies that I show some here, this study showed a much earlier start in this type of work. The average age of working children was 12.9 years, including both males and females, but this finding was younger than documented by previous studies as well. 75% children work in the agricultural sector. More female children, 85%, worked in agriculture than males. And the other sectors that we collected information on are construction sector, scavenging, and other fields of work. Children were prone to the hazardous exposures encountered in the agricultural sector, as you might assume. 30% of children reported having been injured at work, including both males and females, but the prevalence of workplace injury was higher among males than females. It was 25.9% for females, whereas it was 34.4% for males. 18.3% children were enrolled in school in 2017. The percentage of males attending school was slightly higher than that of females. 50.5%, even 51% of children did not attend school because of work. This is what they reported to us. As for the key findings on working children between the ages of 8 and 18, 93% told us that they were fatigued at work. 94% of females reported this kind of fatigue as compared to 91% of males. Working children also reported fever, body weakness, imbalance, tachycardia, and cramps at work. 43% of males and 41% of females have been verbally abused at work. Boys reported feeling threatened, being hit slightly more than girls. In conclusion, because I want to abide by the time and I want us to have a discussion perhaps, Syrian refugee children have had to work in poor conditions to ensure their family's survival. This is the result of the transient poverty and humanitarian aid falling short of addressing their needs. Children as young as 4, I showed you the number, 287 children between the ages of 4 and 7, are compelled to work, and many forego education opportunity in favor of work. Child labor has been a coping strategy for Syrian refugees living in informal tented settlement in the Beqa Valley in Lebanon. This echoes what Yara has told us in the introductory presentation of this session, that Syrian refugees are resorting to various coping strategies in order to meet their basic needs. I'd like to acknowledge many people, but mostly the surveyed population that allowed us into their homes and told us their stories. The data collection team, the research team, who is a big number, and it's difficult to list them all here. Our funding agencies, including IDRC, ILO, UNICEF, FAO, and also the Ministry of Labor, the Child Labor Unit at the Ministry of Labor, who was very keen on documenting the plight of the Syrian refugees, the children working in the agricultural sector, and all those who supported the study. And thank you very much.
Thank you, Doctor. Thank you, Doctor, for this presentation. We're going to take some time to answer questions and discussion. I would like to ask you if we can start and benefit from the presence of Dr. Fawaz with us, and start maybe with a round of questions directed towards the experience of Al-Majmu'a and issues that affect microfinance and socioeconomic situation of refugees as a first round of questions, and then we move to the other presentations. And if you can introduce yourself.
Yeah, my name is Iman Abu Alwan. I do work since almost 3 years as interpreter with Foreign Mission, IOM, UNHCR, and the refugees. My question is to Yara especially, I guess. Yara, had you studied how many businessmen are investing, Syrian businessmen, not refugees, but they aren't registered with UNHCR, investing in Lebanon? For example, I live in Marilies. Marilies is a commercial area. We have now like 80% of the shops are invested by Syrian. Some had put like $1 million, $500,000, and they all hire Syrian. We have one, for example, restaurant in Rawshi who hired 30 Syrian and others. Do you think these they will return? Had this your study? I hadn't seen any of how many businessmen had put money. How they will return? I think it's difficult for people who invest such business amount return easily. Thank you.
Thank you for the question. We haven't specifically studied that or looked into certain businesses and investments, but I would only assume that, yes, with such large investments, it becomes more difficult to leave your business and go back. But also, unfortunately, a lot of the businesses that are not supported by another Lebanese with them are ending up being closed or being pressured to close. So you also have to consider that with time, will there be pressure on these Syrian businessmen to close their businesses if they don't have a Lebanese partner with them? But it would be interesting to really look at those businesses and see how much people are investing and how it is distributed across Lebanon. Thank you for the question.
Thank you. We have 2 speakers.
Thank you very much. My name is Carol Al-Sayed, and I work at UNHCR. I wanted to ask Dr. Fawaz, what is the correlation between those that have benefited from microfinance or microcredit in terms of then linking on child labor? Do you see any impact in terms of reducing child labor, especially for the younger children, for those families that do take the grants or the loans? Thank you.
Can you also take the question here, and then you'll have 2 questions.
Hi, my name is Aisha. I'm the education manager at Sombola. I also had a question for Dr. Fawaz. What are usually the purposes that you give out microloans for? Are they, in practice, do you see that they're to meet cash flow requirements at home or personal reasons, or all of them are entrepreneurship based or business based loans?
Regarding the child labor, while we don't necessarily measure it or track it the way it has been scientifically done, we do, as a matter of principle and ethics in our own operating procedures, we do not give loans to anyone who employs child labor. So we try to be extra careful when giving out a loan, that none of this money or none of this, the business itself that receives the loan has used it or is employing any child labor. Actually, it is something we do monitor on a regular basis, but without measuring it. We just ensure that this business has no child labor in it. Vis-a-vis the use of the loan, our position actually has changed over the years. When we started, we were a bit rigid and really serious that the money had to be invested in the business. But with time, I mean, we realized that at the end of the day, money is fungible, and there is no point in being so extra rigid, especially that at the end of the day, you'll end up finding that the clients would lie to you. They'll take $1,000 and they'll tell you, yes, it's for my business. You come visit them a couple of months later, you discover they used $500 to pay tuition for their kid. For us, we became a lot more flexible with time, and now today we give loans even as long as we want to have total transparency with the client. We want them to know if they take $1,000, they can tell us we need $500 to pay for a surgery for one of their kids and $500 to invest in the business. As long as we are comfortable that the business they run generates the sort of income that can sustain the loan, we have no problem extending the loan.
Thank you. I think we can move also now to questions that are addressed to other panelists here. Of course. So now to Dr. Delcock.
Nobody waits.
No, yes, sure.
Good morning, I'm Nasser Yassin. Thanks, it was really a reality check, all the presentations, and it's great to see it in an interdisciplinary lens. But I want to ask Dr. Faisal, the trend that we see from the latest vulnerability assessment survey on Syrian refugees in Lebanon showing that the family size is decreasing. Usually, I mean, this is 7 years of displacement. We might still need to see more time to see the change, but it looks like there is a decrease in fertility happening. And all the research among immigrant communities or some significant research shows that usually immigrants adapt to the culture, to the way that the lifestyle that actually host societies or those societies that they went to, whether immigrants or refugees, in terms of their fertility, in terms of their lifestyle and so on. So where we are this, because you showed kind of a very bleak situation, whereas some of the data is showing something more kind of positive.
Thank you, Dr. Yassin. Yeah, I agree with you. We mentioned this. The argument is you will think after 7 years or 6 years that there's some kind of composite determinants like slowing the fertility rate. But fertility rate, you have to wait over time to measure fertility rates and measure birth rates and measure maternal mortality. There are trends. So far, if you go by the simple numbers of non-Lebanese deliveries, they're going up. They're going up from probably 19,000. 2017, I can give you the number exactly. It's like 42 point something thousand versus 68,000 Lebanese. Of course, simple analysis of, oh, okay, the number is increasing, but the family size is increasing also. But what we're sure of is that the fertility rate is not dropping. We're not seeing a dropping trend, but again, this needs time to capture it. We're relying mainly on the total registry of deliveries because 98% of them so far are taking place under skilled attendance. But we're saying more and more cases are happening outside the hospitals or arriving to the emergency room in a very critical situation that might lead to death or to serious morbidity. I agree with you. We should look at this if there is any kind of deceleration or trend. But so far, the numbers are... but command, the denominator is changing.
So,
Jabbour from the Faculty of Health Sciences at AUB. Again, for Faisal, I just wanted to clarify. I heard in your interpretation about the trends, something about pampering, and I didn't quite understand what you meant by this. Somehow it implied that the Syrian refugee women were in privileged situation in Lebanon compared with their back home country. So if you would clarify that, please.
Well, no, the thing is, it's one of the focus group discussions that we held in 2013. I know the situation in Syria. I worked for 1 year as a consultant in the year 2000. And they have, I would say, good coverage. But we're not discussing now the situation in Syria in 2000. But in 2013, a lot of them thought that we are covered by up to 70-75% in Lebanon. Lebanon enjoys good medical care, and we have all these cards and everything. So we thought, among other things, that we complete our families and have our children in Lebanon, because this is a place of good medical care and stuff like this. In addition, of course, to other factors that we have published in a paper with Drs. Ray and Tamar and everything, to replace the dead, the beloved ones, to the children. It's like the typical argument of why you want to have more children under a crisis. But in specific in Lebanon, and in these focus groups in the Beqa region, around my village, because my village we have 22,000 refugees. So most of them would like to say, like, yes, we're going to have them here, good doctors, good medical care and stuff, and we are covered. This is what I meant by there might be a trend why also they want to have their children here, among other things, basically to replace the dead children or the beloved ones and stuff like this, as we have shown in the paper published in the Reproductive Health Matters last year. That's the... You have to look behind the word now. It's not about the word or something. It's not. I meant is those people, they said we are receiving good medical care and we are covered, and this, we believe this is a good medical system. I'm just citing their words, okay? So they felt, and we are taken care of here and stuff. I'm sure they're not comparing to the situation of the pre-crisis, because these people, they're coming from different areas of Syria. And if you want to talk about the situation in Syria, we can talk about the situation of Syria before the war. But they're referring exactly to a situation why they feel they can have their children here, among other things I'm saying. Because they believe Lebanon enjoys good medical care and good medical services and doctors and everything. Okay? That's...
Shall we take also more questions around this?
Hello, my name is Mahmoud Ahmed, and I'm an MBA student at AUB. My question is, what are the causes of C-section increased with refugees?
Yeah, thank you. That's a good question.
يمكن بعد إذا بناخد بعد سؤال إذا طالما سؤال
Any other questions on maternal? Okay. Thank you for the question. See, when you move to a country or to a place, usually you're affected by the type of care. And in Lebanon, this is an OB-led care, and this is unfortunately sometimes over-medicalized type of care provision. So when people come here, you start having the impression of the health system on the individuals, and part of this is the increasing rate of cesarean section. But that happened also in Syria after the crisis. They went also to around 28%, but in Syria, as I know from my colleagues there, it's because in the afternoons, probably there will be a round of bombs and shelling and everything, so they cannot wait for the laboring woman to finish up in a normal vaginal delivery, so they do cesarean so they can go back home in the afternoon. But in Lebanon, once you are in the system, within the hospital and within the OB healthcare, you're affected by all the factors in Lebanon that increase cesarean section, and those again, unfortunately, will be also subjected to having sometimes unnecessary cesarean section. That's why the rate is going up. Okay. Thank you. Thank you, everybody.
I'm not an expert on that, but I don't know how much forward we need to go with this line of question. Maybe we can also. You leaving us?
If you have no questions.
If you want, like 2 minutes to.
I don't want to turn this into a medical session. Dropping cesarean section is like, living on the moon now. It's very hard. It took 15, 20 years in the US to drop it by a few percentages. This is an epidemic. We're all suffering from it. We have a lot of contested ideas about why should a woman deliver vaginally in the first place. So it's a very difficult and sensitive topic. But I think what we can do for the Syrian refugees, at least from a health medical point of view, is to bring more of them early in the pregnancy and give those who wants to plan their birth and space this birth the ability to do that. Thank you very much.
Do you want to wrap up with 2 minutes? 1 minute to wrap up? But this one I'm giving him if he wants to wrap up also. We take more questions. Now more focus on either child labor or water. I don't. Yeah, we cannot take questions on microfinance.
I won't be able to answer on C-section.
Please. The lady in red. Yes.
Thank you for picking up. My name is Aiko Nishikida. I'm from Tokyo University of Foreign Studies, but now based in Berlin. And my question is to Dr. Farjallah and about the environment and environmental influence and the water quality. And of course, we cannot tell in this short term if there is any like environmental effect. But can you, at this moment, can you tell is there like a worse quality of water or scarcity of water because of the influx of more refugees in the Bekaa? That is my question.
Can we take more questions as a round, just so that the speakers are able to better structure, please? And then, okay, and then you again, and then, all right.
Hello. My question is for Dr. Rima Habib. I would like to ask if there's any measures that could be taken to, in fact, decrease child labor.
Then we'll take 2 more questions, the lady and the lady.
Hi, I'm Aisha again from Sombula. I have a question for Dr. Habib as well. In your study for child labor, firstly, did you notice whether it was periodic, that there were periods when children were involved and then they were not? And these children you mentioned were not enrolled in school, but were they part of any non-formal education initiatives or programs, or were they finding alternate ways of finding some education in these off periods, per se?
Hi, my name is Jessica, and I work for a social enterprise called CFAR, and we work on migration and social inclusion. My question is for Dr. Farjala. You mentioned that when you interviewed stakeholders, they said that the problems were water quality and the people who handled the situation for the refugees and not the refugees. It struck me that your stakeholders are sort of mid-level individuals. Is that correct? I was wondering if you got a sense of whether those views were shared by, just host communities themselves, people who are the ones who are facing and experiencing the severe water scarcity. Thanks.
Please, if you'd like to answer those 4 questions. Okay. One last question.
I have a question. How can we stress on the Lebanese law to stop the child labor for Syrian refugees? How come they close shops for Syrian refugees who work for Lebanese people? And how come they do not do that when we meet children working in shops?
Okay, I will start answering the second question. If there were peak seasons when the children are working. Of course, during the harvesting season, we are in Beqa and there is the harvesting season, you would expect that more children are working because they need more person power, working hands. But because of this transient poverty, because they are hardly able to meet basic needs, Syrian families are having to have their kids working not only in agriculture, but in other sectors as well. So we've seen children, we interviewed children who are working in the construction industry. Some of them are scavengers, some of them are picking stuff, iron rods from the fields and trying to sell them. Some of them are working in butchers' shops, in other sectors. So these children are working on an ongoing basis. And that's why they have said, 50% of them said that they are not able to go to school because of work. They have to assist their families. With regard to the Lebanese law, what you have asked, the last question, and whether we are implementing the law or not, Lebanon had to deal with the refugee crisis, and it was just so overwhelming, huge numbers. And we went into phases. At one point in time, because there was this public outcry that by the Lebanese that the Syrians are taking their jobs, so adult Syrian refugees were not really able to go to work. The children are invisible. So this probably caused the surge. At some point in time, it was not really a prolonged period when adult Syrian refugees were arrested, but they feared arrestation if they went to work and took the jobs of the Lebanese, for instance. So it's an issue of policy and an issue of what is it that we are enforcing. The child labor unit at the Ministry of Labor is trying to incorporate the Syrian refugees under in the population and trying to deal with them like they are dealing with the Lebanese population. We cannot have children at work. The worst form of child labor, there is a decree on the worst form of child labor, is to be respected, is to be enforced on both populations, the Lebanese and the Syrian refugees. Enforcement, that's the big question mark. Are we able to enforce that all the time? That's the big question mark. Is humanitarian aid sufficient for all these families so that they don't resort to child labor as a coping strategy? That's another question mark. So unfortunately, I cannot really give a very positive perspective on these issues. There was a first question about recommendations. The recommendations that can probably be put forward in this case is put the children in schools, and children as young as 4 years should not really be working. That's the simplest one. Or probably stop the war. I mean, I can be very optimistic and go there. But what's on the ground, what's realistic is another story.
The two questions asked can be answered together. First, the people we talked to, we didn't address, we didn't go out and talk to citizens, actually. We talked to their direct representatives, which are the municipality leaders. And municipality leaders are representatives of actual residents in those areas. So they live there, they work there, and they reflect people's thinking. So what they reflected was something that, if you look at the issues that they raised, water quality being amongst the very, very, very top, if you look at it, the quality issue has been affected by, and that's why they were saying that it's not really the refugees themselves, but those that manage their presence. Many organizations that manage the presence of informal tented settlements are collecting waste. More waste is generated anyway. With 500,000 people added in the Bekaa, more waste is generated, whether sewage or solid waste. And we all know in the Bekaa, the sewage systems all end up in the Litani. So the problem with the Litani has been accentuated by the additional discharge of an untreated waste. We had a certain amount, it practically doubled. In addition, the solid waste that is now being dumped, many tented settlements waste is taken out, and it was observed by many of those people that we talked to. It was taken out and dumped into the Litani. The sewage taken out of latrines in the tented settlements is cleaned out and dumped in the Litani. And this is not the refugees have nothing to do with that per se. Their presence generates that for sure, but those that are managing it, the NGOs, IGOs, allow that to happen. Okay, so that's where, and it is measurable. You can see there is an increase in the pollution in the Litani and in groundwater extraction. So these are the two answers for me. Thank you.
We already took 15 minutes from the lunch break, and I think a lot of the speakers. But I have to check whether the speakers are able to stay. It's not up to me. If the speakers are able to stay, I'm ready to take one more question. Huh? لا بس انه
سوري لا اجى السؤال هلا لانه حكى عن اشياء قانونيه.
اوكي.
بس بقدر كفي سؤالي؟ هل عندكم علم عن الاتفاقيه القانونيه؟ عن الاتفاقيه القانونيه يلي بتسمح بعدد معين من نازح او لاجئ، قد ايه عدد مسموح فيه للتواجد او للدخول الى لبنان والى الاراضي اللبنانيه؟
ما في اي قانون براعي هذا الموضوع.
العدد
ما في اي قانون براعي هذا الموضوع. المجلس النواب ما اجتمع ولا مره تيناقش الازمه السوريه من 2011 لهلا. إذا عم نحكي على موضوع العمالة بالقطاعات، العمالة الأجنبية بالقطاعات بظن محددة ماني مأكد بالرقم، بس بظن ب 3 أو 10%، 3 ل 10% حسب القطاعات. بس ما في قانون بحدد عدد دخول اللاجئين أو أعداد.
ما في اتفاقية.
ما في أي اتفاقية.
ما في اتفاقية دولية بتحدد نسبة العدد المسموح دخوله إلى لبنان وتواجده فيه وبقائه فيه.
لا
بفتكر هون في شوية لا موجود، وموجود كمان لكلمة نازح.
فينا نحكي
ولا
فيها
أظن لكلمة لاجئ. هلا بعدين يمكن في
نحكي فيها بالله.
نحكي فيها مع قانونية.
شكرا على thank you for your time and for and I think you have an announcement.